Today we will discuss about the tympanic membrane. This tympanic membrane is also known as a drum head. Now when you will have the visualization of the living person's tympanic membrane, this is the normal appearance of tympanic membrane. So we will discuss the anatomy and we will see the different anatomical landmarks of tympanic membrane. So what is tympanic membrane? So it forms the partition between the external acoustic meatus or the canal and the middle ear. Now when you will see the external acoustic meatus, on the medial end of external acoustic meatus, you will find a partition, and this partition is known as the tympanic membrane. Now the most important question for your exam, that this tympanic membrane is obliquely placed into the ear. Now when you will see the canal, in the canal you will not find the vertical placement, it is having the oblique placement. And what is the angle? It makes around 55-degree angle with the floor of external acoustic meatus. So when you will see, this is the floor and this is the tympanic membrane, the angle is somewhere around 55-degree. So this will become the important question in your exam. Then the second thing is that because of this placement at the angle of 55, what will happen? That its postero-superior part is more lateral than the antero-inferior part. Clear? So the postero-superior part is more lateral. That means this superior part is come laterally and this inferior part will go medially. That means this oblique placement is causing the downwards, forwards and lateral placement of tympanic membrane. So there are two questions. One is, what is the direction of tympanic membrane? So when you will have the direction, it is downward, forward, laterally placement, and how much angle it is going to form with the floor of external acoustic meatus? Answer is 55-degree. Now it is around 1 centimeter in diameter with 0.1 mm thickness, and it is concave towards the external acoustic meatus. So when you will see the concavity, you will realize that in the middle portion the concavity is there. So this is the placement of tympanic membrane. So this is the concavity on the external acoustic, and this convexity enters towards the middle ear cavity. Now what are the parts of tympanic membrane? When you are writing the short note in exam, you have to be specify the two parts are there. One is known as pars tensa, another is known as pars flaccida. And pars flaccida is also having the another term is known as Sharpnell's membrane. Now in this diagram you can see that the major portion, this is known as pars tensa, while this smaller upper portion is known as pars flaccida. So these are the two different parts of tympanic membrane. Now first about the pars tensa. What are the features of pars tensa? So the periphery of the tympanic membrane is thickened and it forms a fibrocartilaginous ring. So this is the first thing which you have to understand, that if you will have a ring and that ring is having the thick margin, that thick margin of the ring is known as annulus tympanicus, which is made up of fibrocartilage. Now this margin, thick margin, is going to fit into the groove, and that groove is present into the bone, and that bone groove is known as tympanic sulcus. Clear? So what will happen, that there is a groove present into the bone, and inside that groove this thick margin will set itself, and that margin itself is known as annulus tympanicus, and that groove is known as tympanic sulcus. Now there is a important thing is known as handle of malleus. Now we know that inside the middle ear you will have the ear ossicles, and there are three ossicles: malleus, incus and stapes. So the malleus bone is having a part, and that is known as handle. So this handle is firmly attached to the inner aspect of this tympanic membrane, and this handle is responsible for the tensioning because there is a muscle attached on this handle. So that is reason that this part is known as pars tensa. So, pars tensa form, and this part forms the major contribution or major area of tympanic membrane. It is held tense by the inward pull of a muscle is known as tensor tympani muscle. Now, in this diagram you can see that this is the malleus bone. Now, this lower part is known as handle of malleus. This handle is attached on the inner side of tympanic membrane, and this handle is pulled by the muscle is known as tensor tympani, and that pull is responsible to create tension in this membrane. So, pars tensa is remain tense because of the indirect impact of this tensor tympani, which is causing the stretch or the tension into the handle of malleus, and the handle of malleus is attached to the inner side of tympanic membrane. The central part of the pars tensa. Now, see, you are saying that we are studying that there is a point where the handle of malleus is get attached. So, that point of attachment is having the inward tented inward, and it create a small concavity, and this point where the tip of handle of malleus attached is known as umbo. Now, this is again the very important one line question for your exam, that what is the cause of umbo of tympanic membrane. So, the answer is that the umbo is nothing but it is a inward concavity which is created because of the attachment of the tip of handle of malleus with the inner aspect of tympanic membrane. So, this is the important thing. Now, there is a one more question about this, and it is the feature, and this feature is cone of light. Now, what is cone of light? When you put the light on a living person's tympanic membrane, then what will happen? There is a cone appears from the umbo. Now, this is the cone. Now, when you will have the cone, you will have the apex and you will have the base. Now, this apex of a cone is start from the umbo. Now, this is the live image, and in this you can see that this is the cone, and this cone starts from the umbo, and it is, as you will go downward, you will have the broadening of the light. So, this cone of the light is a feature of living person's tympanic membrane, and the most common question asked is that it is present in which quadrants of pars tensa? Answer is antero-inferior quadrant. Now, you can see that this is the tympanic membrane of my left ear, and when you will put the light in this external acoustic meatus, and if you will do the examination, you will realize that we will divide into the compartments. So, this is the antero and inferior quadrant of tympanic membrane. So, antero-inferior quadrant showing the cone of light is true statement or not. This type of question you may have in exam. So, these both lines are important as per your exam points. Then we have the next part is pars flaccida. Now, as the name suggests, flaccida means that it is a loose part. So, this is a loose part, and I told you that it is also known as Sharpnell's membrane. Now, what will happen that the tympanic sulcus is not present in the whole circumference. Now, in the upper part, the sulcus is deficient, and that area between the two edges of this ring is known as notch, and it is known as notch of Rivinus. So, notch of Rivinus is the part where the sulcus is absent. Now, what will happen that the two bands, the anterior and posterior malleolar folds, they pass from the ends of this notch of Rivinus towards the lateral process of malleus. Now, here you can see that this area is having the notch. Now, here you can see the thickening which is known as annulus tympanicus. Now, but when you will go above in upper part, there is no sulcus. In this area, sulcus is absent. Now, what will happen? This area is termed as a notch. Now, the margins of the notch are sending the two folds. These folds are known as anterior and posterior malleolar fold, and these folds are approaching to this bony part of the malleus, which is known as lateral process of malleus. Clear? So, this was the handle of malleus, which is responsible for the umbo, and this is known as lateral process of malleus. So, till there you will have the two folds, and this area between the notch and anterior posterior malleolar fold is known as pars flaccida. So, the small triangular part of the membrane between the folds is known as pars flaccida, and as the name itself suggesting, it is a lax part and it is thin in nature. The another important thing is that it appears slightly pinkish as compared to the pars tensa. So, when you are reading the tympanic membrane, you have to understand that tympanic membrane basically divided into the two parts. Major portion is known as pars tensa and a small upper part is known as pars flaccida. Now, the pars flaccida of the tympanic membrane and the neck of the malleus are crossed internally by the chorda tympanic nerve. Now, this is again the question of your exam, which has been asked so many times, that what is the relation of tympanic membrane and chorda tympani nerve. So, the first answer is that when you will see the tympanic membrane, suppose this is of my left side tympanic membrane, this is the external surface of tympanic membrane, this is the inner surface of tympanic membrane. So, chorda tympani attached on or related with inner surface or outer surface, answer is inner surface. Clear? Then in the tympanic membrane, more specifically, which part? Answer is pars flaccida. So, the tympanic membrane, the pars flaccida is crossed internally by the chorda tympanic nerve. It passes out from the front of the middle ear and emerges from the medial end of petrotympanic fissure. Clear? So, now in this diagram you can appreciate that this is your chorda tympani nerve. Now, what is the image is showing that this is the cut margin of your tympanic membrane. So, when you will have the tympanic membrane, for the demonstration purpose, what has been done in this diagram, that the annulus is there, but the remaining part of the membrane has been removed. Now, as soon as you will cut the tympanic membrane, you can see inside there is a handle of malleus. This is the handle, this is the lateral process of the malleus. Now, just behind this you can see this yellow color line, and this yellow color line is present in the upper part, which is known as pars flaccida. Clear? So, the first question for your exam, that chorda tympanic nerve related with which part of the tympanic membrane, answer is pars flaccida, or it can be the vice versa. Then in these two diagrams you can appreciate more clearly the tympanic nerve. Now, when you will have the examination of the tympanic membrane, you can see that a thick cord is visible here. Now, this thick cord is the chorda tympani nerve. Now, in this part, in this image, you can see that this is you are seeing from inner side. Now, this is the external surface of the tympanic membrane. This is the medial surface of tympanic membrane. And I told you that tympanic membrane related with the medial side of your tympanic membrane. So, here on the inner side you are first able to see the tympanic membrane, then the handle of malleus, and then the tympanic membrane itself comes. So, you have to understand this concept that whenever we are talking about the pars flaccida, we always talk about the chorda tympani nerve, which is present horizontally in its upper part. Clear? Now, this will give the idea about the entry and exit of the chorda tympani nerve. Now, chorda tympani nerve is a branch of the facial nerve. Now, here you can see that it will come out from the stylomastoid foramina, but when it is running downward into this canal, it is giving a nerve which is known as chorda tympani nerve. Now, this chorda tympani nerve enters into the middle ear cavity through the posterior canaliculus, and then it will come in relation with this upper part of your pars flaccida, and it finally come out from this area. Now, what is this area? Now, this area is the articular surface for the head of mandible, which is known as mandibular fossa. In the mandibular fossa, you are having a fissure is known as patrotympanic fissure. So it will come out through the patrotympanic fissure. Now in this diagram you can see that this is the patrotympanic fissure, and this patrotympanic fissure is having the exit of chorda tympani nerve, and this chorda tympani nerve later on joins the lingual nerve. So the question comes here about the chorda tympani nerve. So through which fissure it will come out? Answer is patrotympanic fissure. Now what are the layers of tympanic membrane? Now when you will see the formation of tympanic membrane, it is consists of the three layer: outer, middle and inner layer. Outer layer of the tympanic membrane is continuation of the skin, that means it is lined by the stratified squamous epithelium. Now when you will see the inner part is nothing but it is a mucosa, and this mucosa is lined by the columnar epithelium. Then the middle fibrous layer. The middle fibrous layer is made up of collagen fibers, and this layer is responsible to form the framework of this tympanic membrane. Now it consists of the handle of malleus, and it has three types of the fibers. Now this is the important question for your exam, that when you are talking about the fibrous layer, what is the arrangement of fibers? In the fibrous layer, fibers are arranged in three ways. One is the radial, second is the circular, and third is the parabolic pattern. Now in this diagram you can appreciate all the three patterns. Now this is the radial pattern, where you will have the fibers are going in all the direction from the center. Then the second is the circular. Now circular fibers are here, which you can appreciate, they are forming the encircling each other. And there is a third set of the fiber, which you will see here, that these fibers are parabolic in nature. I hope you can appreciate these fibers in this diagram. Now this is the one fiber which I am tracing here. This is the parabolic fibers. So parabolic fibers are also there in this image. So you will realize that there are three pattern of the fibers in the middle fibrous layer: radial fibers, which will go in all the direction; circular fibers encircle each other; and parabolic fibers, which are U-shaped fibers, which you can appreciate in this diagram. So the fibrous layer in the pars flaccida is thin, and it is not organized into the various fibers as the pars tensa. So this is again the important thing, that whatever we are talking about the arrangement, we are talking about in this lower part, that lower major part is known as pars tensa. This arrangement is not seen into the upper part, that means in pars flaccida. Now, what are the various landmarks you are able to see on examination of tympanic membrane in a living person? So when you will see the examination, now in this examination, this is the intact tympanic membrane. Now in this intact tympanic membrane, the first thing you are able to appreciate the handle of malleus. And I told you that from the handle of malleus, from antero-inferior aspect, you will have a cone of light. Now apart from that, this healthy tympanic membrane allow some appearance of the deep structures. What are they? Like the shadow of eustachian tube, like the shadow of your foot of stapes and the joint, you will have the shadow of round window. So these may appear through the healthy tympanic membrane. Sometimes you can also appreciate the chorda tympani nerve. So if you will cut the margin of tympanic membrane, and if you will remove this margin, this tympanic membrane from the margin, inside that you can appreciate this is your handle of malleus, this is your chorda tympani nerve, which is horizontally placed in the upper part. You can see this is the stapes, and you can see this is the round window. Sometimes you can also appreciate the image or the appearance of promontory. Clear? Now in this diagram, you have to understand that this is your tympanic membrane. Now this tympanic membrane is having the external surface. This is the medial surface facing towards the middle ear cavity, where you will have the attachment with the handle of malleus. This point is known as the umbo, and this umbo is giving the origin of the cone of light, which appears on the external surface of your tympanic membrane. Now, what about the nerve supply? Now, this is very commonly asked question. Again, when you will have the small one-liners or the MCQs, this question become one of the very common question in the exam. The answer is that the nerve supply on the external surface and nerve supply on the inner surface. On inner surface or mucosal surface, you have only one nerve, and that is a branch of your ninth or the glossopharyngeal nerve. This is known as tympanic branch, or it is having a one very important name is known as Jacobson's nerve. So, this Jacobson's nerve is a sensory supply of medial or mucosal surface of tympanic membrane. When you will talk about the outer surface or meatal surface supply, then you will have two names. One is auriculotemporal nerve, which supply anterior half, while the posterior half is supplied by auricular branch of vagus nerve. So, in nutshell, there are three cranial nerves contributing in the supply. First is the fifth cranial nerve, which is giving the mandibular nerve, and from mandibular you have auriculotemporal. Second contribution is from the vagus nerve, which is the 10th cranial nerve, and the third cranial nerve is 9th cranial nerve. So, this is the question of your exam: which of the following cranial nerve is not contributing in the nerve supply of tympanic membrane? So, the most common option you will have is the 7th, because facial nerve is not contributing here, but for the confusion, this option is always there. So, you have to keep this thing in mind that tympanic membrane is supplied by the branch of 5th, that is auriculotemporal, branch of 10th, that is auricular branch, and branch of 9th, that is your Jacobson's nerve. Then blood supply. The external surface is supplied by the deep auricular artery, and this deep auricular artery is a branch of the maxillary artery. Then you will have the mucosal side, or the inner surface is supplied by the anterior tympanic. Anterior tympanic artery is also the branch of maxillary artery, and you will have stylomastoid branch of your posterior auricular artery, which is again a branch of maxillary artery. Now, the important thing is that anterior tympanic again enters through the patrotympanic fissure. So, in this class, you heard this patrotympanic fissure at two places. One is that this fissure allow exit to the chorda tympanic nerve, and second, this fissure allow entry of anterior tympanic artery inside the middle ear. Clear? What about the stylomastoid artery? The stylomastoid artery enters into the stylomastoid foramina, where it will supply blood to the facial nerve, and then it enters into the middle ear, and inside the middle ear it will form a anastomosis, and through that circular anastomosis it supply the mucosal side of your tympanic membrane. So, when you are writing the blood supply of tympanic membrane, the three names will come: deep auricular artery on the external surface, anterior tympanic, and stylomastoid artery on the mucosal surface of your tympanic membrane. Now, when you are examining the tympanic membrane, you have to look for the four important things. One is the color of tympanic membrane, position or the placement, its surface, and mobility. Now, when you will see the color, the normal tympanic membrane is pearly white. Now, this is again the question. Now, see, the pearly white appearance comes at two places. One is, what is the normal color of vocal cord? Again, the answer is pearly white. Second, what is the normal color of tympanic membrane? Again, you will have the pearly white. Apart from that, the tympanic membrane is semi-transparent, but if the color is not pearly white or it is red and congested, it is a sign of the infection inside the middle ear, which can be otitis media. The tympanic membrane position, if there is a excessive concavity or the convexity is there, it is showing the retraction or bulging, which again a abnormal sign. Then you will have the surface. Now, normally tympanic membrane is smooth, but if there are vesicles present, it can be the feature of herpes, or sometimes there is a small perforations are seen into the tympanic membrane. Then lastly, the mobility. Normally the tympanic membrane is mobile. When you will have the normal living tissue In a living person, tympanic membrane is mobile. The restricted mobility is seen due to the presence of fluid or the adhesions inside the middle ear cavity. So, there are few terms which you have to understand. These are again one-liner question. One is known as myringotomy, or it is also known as tympanostomy. Now, you know that tomy means cut. So, the incision is made on the tympanic membrane, and purpose of this incision is to drain any kind of the effusion inside the middle ear or to provide aeration for the malfunctioning eustachian tube. Clear? So, what is myringotomy? To put an incision on tympanic membrane. But the important thing is you cannot put the incision on pars flaccida because there you have the chorda tympani now. Then what is myringoplasty? Plasty means repair. Now here the reconstruction procedure to limit or repair the perforations of tympanic membrane. Then the last part about the development, which is again the one-liner question for your exam. So we have seen that there are three layers of your tympanic membrane. Outer layer, then you will have middle fibrous layer and inner mucosal layer. So outer layer develops from ectoderm, middle layer develops from mesoderm, and the inner layer develops from endoderm. So this is the very important and commonly asked question, that which part or which structures of the body have the contribution of all the three germs layer. So this is one of the example where all the three germinal layer is having the contribution. Outer epithelium comes from the ectoderm, middle comes from mesoderm, and inner comes from endoderm of the embryo. So at the end of this class of the tympanic membrane, I hope you have the idea about the placement of tympanic membrane. What is the difference between the pars tensa and pars flaccida? What are the important features of the pars tensa? Then the most important thing, which is a very commonly asked question in exam, is the nerve supply of tympanic membrane. And lastly, what is the myringotomy, what is the myringoplasty, and the development of tympanic membrane. So this is all for the class. Thank you.